Hello, everyone. Welcome. Get started in just a minute here. I'm sure people will be kind of trickling in. All right, so just in the interest of time, I think I'm just going to go ahead and get started. So thanks everybody for being here. I'm Amanda Pratt. Many of you already have heard from me over the past couple of days, but I'm working for Porta Sophia, the nonprofit psychedelic prior art library that we're all kind of gathered here to support, and specifically working on the archival researcher network, the archival side of the data team at Porta Sophia. And really facilitating this new network that's kind of we're all gathered to connect about. So I made you a co-host, Cece, if you want to let people in as I'm presenting or sort of introducing. So today I'm really excited to host our keynote event for the kickoff event. And we have Priti Krishtel here, who is from IMAC, and she's going to give a talk called Reflections and Predictions, Experiences from the Access to Medicines Movement. And I'll just briefly read her bio and then pass things off to her. So Priti is a health justice lawyer and the co-founder of IMAC, which is a nonprofit building a more just and equitable medicine system. She has spent nearly 2 decades exposing structural inequities affecting access to medicines and vaccines across the global South and in the United States. That includes advocating for equitable access to COVID-19 vaccines across the globe, to ensuring that the Biden-Harris administration is prioritizing equity in the Patent and Trademark Office. To improve equity in the patent system, she and IMAC have developed a new tool called participatory change making that will provide an assessment of the patent system and bring together stakeholders from across the spectrum, from patients to investors and policymakers, to drive sustainable long-term change into what has long been an exclusionary process. Krishtel and IMAC have also put out a 10-point plan for the Biden-Harris administration to bring equity into the patent system. She's a TED speaker, presidential leadership scholar, and Ashoka Fellow, and a frequent contributor to leading international and national news outlets on issues of domestic and global health equity. So I think we're really, really excited to have you here, Priti, and looking forward to hearing your sort of predictions for all this work and what it means for the psychedelic space. And just a note, if folks could keep their microphones muted during the presentation, we should have some time for Q&A afterwards. So basic Zoom etiquette in that regard. So yeah, join me in welcoming Priti.
Thank you, Amanda. Yeah. It's so nice to be here with you all today. So I think got introduced to your community about a year or two ago. I can't remember exactly. And I have started to learn about the space. I'm still learning. But what I have learned, I can just say that my team and I are in really deep admiration of the work all of you are doing. It's really, it's life-changing to say the least. So thank you for having me. You know, in the last 2 years, I think the world has changed a lot. And I just wanted to start by telling you that 2 years ago, when COVID first hit, I don't know if you remember the early days in March when we first went on lockdown, but about 4 weeks into lockdown, or maybe it was 3 weeks, I got a call that my cousin had actually taken her life. And we had, a couple of days later, we had our first, family Zoom funeral. And my aunt shared a story that I just wanted to share with you all about what had happened. And she basically told us, so my cousin lived with different mental health conditions, and she lived in a care home at the time that the lockdown was first announced. And in the chaos, I'm sure you guys remember, it was very chaotic right when COVID hit because nobody knew anything back then. And so the care home actually lost my cousin. And so she had left the home. She was walking around on the street, going into different stores and shop fronts and things like that, trying to ask for help, trying to ask basically just to use a phone. And what my aunt shared was really heart-wrenching, which is that as she went into store after store, people would scream at her because they were afraid, because we didn't know much about the virus, and to get away and to not come near them and to know she couldn't use the phone and things like that. And so when my aunt shared this story at the funeral, what she basically said to us was, she said, I want to invite you for the rest of this pandemic, or, however the world unfolds now, to think about what you are doing with more compassion imbued into your actions that you might otherwise think to, deploy in a given situation. And that has really stayed with me over the last 2 years in terms of thinking about how we change these huge systems for health, for knowledge, and how maybe even in our own actions individually and as a community, we think about imbuing that compassion into whatever we're doing. I share this story because I just wanted to say before we even start, that my admiration for your work is personal. It's very personal, not just on mental health, but also on, Graham has educated me on many of the conditions and diseases that people are working on in this space, degenerative disease and inflammatory conditions. I mean, all of it, I think, impacts all of us on the planet very personally. And what I see in the potential of what you all are doing in this moment is the, absolutely transformative power that you can have on a person's life if the right medication is developed. You can help people stay alive. You can help people improve their quality of life, economically be better off to be able to work and support their families. And then by extension, for all of us who have been caregivers or family members of people who are suffering from a variety of conditions or diseases, there's a ripple effect to what you're doing for the whole social safety net, and for the whole health system as a whole. So I just wanted to frame everything I'm going to share in that context, that I think you all are at the precipice of fundamentally transforming our society. And so I hope that the stories that I'm about to share are going to be useful in helping you think about how the systems that you are working in and are going to work in might need to be evolved as you go up doing your transformative work. So I want to spend our time today. Basically, I'm going to start by sharing 3 quick stories with you. And then I'm going to loop back to talk about the present moment with COVID and the work you all are doing to talk about the future. And so the 3 stories I wanted to share, the first is about my very first clients as an attorney. The second is about one of our first cases at IMAC, that's the organization I co-founded and co-direct today, one of our very first cases on behalf of women and children. And then lastly, looping back to the US and what's happening with the drug pricing fight. So starting with the first story, when I was 24, I ran a legal aid office in India. My first clients were a couple. They both had HIV, but his had turned into full-blown AIDS. So he was in his final days. She was infected, but she knew that her fate was going to be the same as her husband, because even though medication existed in the higher income countries, it certainly wasn't reaching people worldwide. And she knew she was running out of time. So they had come into my organization. I was working at the Lawyers Collective at the time. They had come into the Lawyers Collective office to ask our attorneys to draw up adoption and guardianship papers for the kids. And that moment when I was standing there, I was running the office and I was watching the kids playing. They had no idea how their lives were about to change. And the mom her kids were the same age my kid is right now. They were toddlers, and she was signing those papers. I was hit by the injustice of it all. And it was at that moment that I teamed up with my co-founder, because in the years that followed, we actually worked with hundreds of families like this who were separated because even though the medicines existed, they weren't able to get them. So we decided that nobody should have to live like this, that we wanted to set up a nonprofit, which we affectionately call IMAC, the Initiative for Medicines Access and Knowledge, that would start to build a more just and equitable system for medicines. And so one of our first cases once we started IMAC was with the Positive Women's Network. It's a network of women living with HIV in India who were advocating for more equitable treatment on behalf of themselves and their children. And they had come to us because of a specific pediatric version of an HIV drug that was not being made accessible or affordable to them. And so the company who owned the drug product was filing, a lot of patents on the drug, as drug companies do, including a syrup form of the drug, which was for pediatric use. And, the basic concept, as you all are aware, is there is an invention and it should get a patent. That's how the system is supposed to work. But what we were seeing across the HIV portfolio was that companies were filing many, many patents on each drug product with the specific intention of lengthening the period of exclusivity on the market so that they would be the only ones on the market. And in particular, at that time, so that manufacturers in India could not also start to become suppliers. They wouldn't have competition, basically, because India was exporting medication all over the world. And so they wanted to sort of corner the market. So that's what this practice was about. So when the Positive Women's Network approached us at that time, they asked us to look into the situation and what could be done. And so we dug in. We were a team of attorneys and scientists, and we started to dig into the patent portfolio, and we identified that this patent was a blocking patent. Now, India at the time had a very robust pre-grant opposition mechanism, which basically means you can challenge patents before they are granted. And so this was a pending patent application. And we went in, and alongside the Positive Women's Network, we challenged the patent. Now, we won the case, and that opened the door for other generic competitors to enter the market and for low-cost versions to be supplied not only to India, but to people worldwide. And so this was the start of a movement worldwide to start to challenge patents. In the years that followed, dozens of civil society, patient-led human rights groups worldwide started to challenge patents in low and middle income countries. And in the few years that followed that victory, we saw $2 billion get unlocked for health systems by sort of removing these blocking later stage patents that weren't actually inventive or novel, that weren't actually adding value in the ways that we think about when we think about the fact that the patent system should be rewarding true invention. So that's sort of the first, 10 or 15 years of our work. From there, in 2015, we came to the United States, and we started to ask the question of, we were seeing billions of dollars in cost savings in the developing world by removing later stage patents. What would happen if we took a look at the patent portfolios here in the United States? But before we did that, we wanted to make sure we really understood what was going on with access to medicines in the US. And here what we found was that this was an issue actually of prescription drug costs, or drug pricing, as a lot of people call it here in the US. What we learned from many of our partners here was that 1 in 4 Americans is having trouble affording their medication. And for people who take 4 or more pills, it's actually 1 in 3 Americans who are reporting difficulty in affording their medication. Now, 1 in 5 Americans actually reports that somebody they love has died because they couldn't afford medication, and that's twice as true for people of color. So through working with different patient networks and advocacy groups, we came to this understanding about the problem around healthcare costs. So then our job was to try to understand, well, where do patents fit in, if at all? Now, there were many high-profile incidences of, bad actors in the pharma space around that time. But what we were most interested in was what's actually happening to everyday Americans. Whether it was a law student who was dropping out of school, or a young person who came off his mom's insurance and wasn't able to afford his medication and then passed away, or the increasing number of senior citizens who are filing for bankruptcy because of the unaffordability of medication, especially noting that seniors have to take more medication and different medications as different health conditions start to emerge and progress. So at that time, when we came into the US in the first few years, there were leaders on both sides of the aisle who were saying we have to do something about prescription drug costs, who were naming patent abuse as a problem, but not much was being done. And so we decided to actually investigate and expose where patents, but more to the point, the power that the drug companies had to block competition, delay access to market, hike prices, was playing a role. And so through our research, we came to the conclusion that we wouldn't be able to solve the drug pricing crisis in America until we addressed the drug patent problem. And one notable example of this is the top-selling drug Humira, which you may have heard of. It's the best-selling drug. It's been the best-selling drug in America. It's been the best-selling drug in the world. But what's most interesting to me about this drug is that Europeans got biosimilar versions or low-cost alternatives, which were actually much lower cost in 2018. But Americans are not going to get those lower cost versions until 2023. And during those years, Americans are going to spend $70 billion on Humira, on this one drug alone. So we started to investigate all of the best-selling drugs in the country. And around this time, the New York Times editorial board put out a piece in advance of the Senate starting to grill drug maker CEOs. And they noted that, from some of our research, that over 100 patents have been granted on Humira. Now, what we were actually finding was that while AbbVie was certainly, we named them worst offender on this issue for Humira because they had filed for 247 patent applications at this time, what we actually found was that this was a bit of a systemic problem when it came to the best-selling drugs. Whether you were talking about cancer or you were talking about arthritis, companies were definitely looking to see how can we extend our exclusivity period on the market by employing, really clever patenting techniques. For example, these numbers are from 2018, but on Enbrel, the arthritis medication, in December, Congress put out an investigation, a report, where they looked at all of these drug makers and subpoenaed their documents and revealed what the drug makers themselves had said, in their internal meetings. And it was very interesting, a company like the one that makes Enbrel was very explicit that they needed to figure out how to block competition for longer. They needed to come up with a clever tweak, like a new device, in this case, the Enbrel Mini, get more patents on it, and then extend their period of exclusivity where they wouldn't have competition on the market. And what we saw as a trend over time, over the last decade, actually, we looked at the period between 2014 and 2019, we saw that when drug makers deployed these patent tactics, they would actually also engage in a series of price hikes to maximize that final period when they would have exclusivity on the market. So a lot of people have talked about what it's going to take to fix the system. I want to flag here one thing, that the issues I'm talking about as an access to medicine advocate are about access. They're about affordability. They're about the ability of patients to actually get the medication they need. But there's also a growing acknowledgement that when you don't set the bar high, for what can get a patent, meaning you just hand out patents for a lot of things that shouldn't be considered true inventions. You actually disincentivize innovation, or you incentivize legal gamesmanship. So this is also from around the time period that we first released that research. This is from 2019, so it's pre-pandemic. It's giving you a snapshot prior to the pandemic of the state of creativity in the industry. And the chart shows how much of each company's sales are coming from drugs fresh out of the pipeline versus how much were coming out of, older medicines. And the answer was 11%. Only 11% of revenue was coming from drugs that were developed in the 5 years prior to 2019. Now, this was a very telling slide for me when I first saw it, because it also explained to me, as someone who had worked in the global South for a very long time, why it is really problematic that the US is exporting a system that's not actually working for Americans. They're exporting it worldwide with the same gut-wrenching consequences for patients everywhere. And so this is where we really started to drive a conversation about patent reform for the country. And over the last 7 years since we launched our US program, we've seen numerous congressional hearings about high drug prices, about the patent problem. We've continued to see people losing their loved ones as the cost of drugs and the prices of drugs skyrocket. But it was only recently in the last 2 months that we are seeing, I think over the last 2 years, actually during the pandemic, we're seeing public opinion start to shift. Now in April, the New York Times editorial board endorsed patent reform formally. So this was a big turning point. And the framing of the article, if you haven't read it, focused on 5 key areas. The first is that we need to raise the bar. We need to really make sure that we're granting the highest quality patents. The second is, and this is somewhere that I think Porta Sofia's work and maybe many of your work is really, it fits squarely within that recommendation of how do you raise the bar? And what are the ways in which government and civil society can collaborate to make sure that we can do that? The second was, expand and fortify the system for challenging bad patents. Now, we grant a lot of patents that shouldn't have been granted in the first place as a country. So how do you make it easier to make sure that those patents, which never should have been granted in the first place, those decisions can easily be changed, allowing for expanded competition? The third, and I don't feel enough work is actually being done here, is to eliminate potential conflicts of interest. The patent office is a bit of an island, and it's a bit of a revolving door where people come in and out of industry to lead the agency, and it creates a disincentive to actually make change that could better serve the public. Another area I think that this community might, really start to intervene is this idea that the agencies are all islands, but how do we get, for example, the FDA and the PTO to work more closely together, for example, to track applications in the areas that you all are doing research on? And then lastly, and this is an area I would love to see this community get more active and engaged, is how can the public actually participate in the patent system? There is, of course, the users of the system, those who are applying for patents, which may be some of the companies in your community. There are the investors too, but what about the researchers and the advocates and the patients and the people with lived experience who are trying to bring these medications to people? How can their voices be heard, both with the PTO and actually with the FDA as well? And so I think, that is starting to form kind of a foundational platform for an agenda for patent reform. The idea being that we can transform the system, bring it into the 21st century, which it still hasn't really done, to also address some of these emerging issues in science and medicine that we're seeing. Which brings me to the present and to discussing the future. So I want to speak very briefly with you about COVID. The COVID vaccine has been the turning point in shifting public opinion on this issue. In the last 2 years, we've seen world leaders, celebrities, academics, civil society, growing movement with thousands and thousands of people stepping up to say that what is happening with the development and distribution of COVID vaccines has been fundamentally unjust. Now, a year into the pandemic, very few people had access to the vaccine. And the map looks something like this, a year into the pandemic. But even today, it's a year and 3 months after the visual depiction on this slide, only 15% of people in low-income countries have actually even received a single dose of the vaccine. And last month, the United Nations Commission to End Racial Discrimination came out with a very strong statement connecting these disparities to colonialism and slavery. They criticized the Western world, which includes specific countries in Europe and also the United States, for the actions that we are taking to block or impede the waiver on intellectual property that's been discussed and debated at the World Trade Organization. And they specifically called out intellectual property as a system that fundamentally needs to be transformed. So it was a very powerful statement. We always say that in order to make change, you actually have to identify root causes of problems. And so this step by the UN was a big turning point that's happening right now in real time. The other thing, of course, that's happening in real time is the patent land grab on psychedelics. And I don't need to explain any of this to you all, but to connect the dots a little bit, I just want to locate you in the work that I just described that's been happening worldwide, whether it is the global fight for a more just intellectual property regime on COVID, but also on global health more broadly. And the ways in which high-income countries are hoarding knowledge and ultimately medication, vaccines, and diagnostics, to the efforts that are happening domestically here in the United States to fundamentally reform the system for patents to make sure that people can get the medication they need without excessive individual or societal cost. The work you all are doing is sort of located right at the heart of all of this. It spans domestic and global, and it is poised to be, I think, catalytic to help people understand the way the general public started to understand the inequities in the system. When we saw vaccine nationalism in the last 2 years, where high-income countries kept buying up boosters before low-income countries even got their first doses, the work you all are doing to, look at this knowledge that has existed for a long time, develop it, research around it, get marketing approval, and then make sure those therapies reach patients is going to be similarly, I think, very catalytic. And so I just wanted to invite you all, if you haven't read the New York Times editorial, invite you to read it, to perhaps spend time as a community thinking about what are the ways in which what you are doing is actually reshaping the way intellectual property works in practice, because it is. And to tell us, there are 5 recommendations in this editorial. There are many that didn't make it into the editorial, but we need to make sure as the Access to Medicine movement that we are learning from what you are all seeing and doing in real time. So if there are things that are happening that you think need to be part of the broader agenda for reform efforts, whether that's, legal reform, it could be changing laws, it could be filing court cases, it could be filing patent cases or changing the rules of the patent office, but it might also be culture change, right? So much of the work you are doing takes me back to what my aunt said, what I shared at the very beginning of this, which is I think your community is asking, how do we do business differently? When systems and structures are pushing everyone, the incentives are pushing everyone in this direction, but we want to see a different set of outcomes. How do we move differently in the world to be that change and model how it can be done? I think you're asking how research can be done differently and how the fruits of that research can go against market incentives in some ways, or evolve market incentives to help reach the people who need it most. And so as you do that work, let's figure out how to build a more comprehensive agenda for reform, and just continue to grow the movement, because people need it. People's lives are depending on this. And so you can reach us anytime. If you want to follow us and our newsletter, you can join us at imac.org/join. But also, if you want us to feature some of your work in the newsletter, we're happy to do that. A lot of policymakers do read the newsletter, and it's a good place for us to lift up some of these issues. And you're welcome to DM me anytime on Twitter if you have ideas about how we can broaden the agenda or deepen the agenda for reform to advance our collective goals of making sure that medicines can be affordable and accessible for everyone. Thank you so much.
Thank you, Priti. That was wonderful. All right, so we've got lots of time for questions. And I'll just kind of open it up. Folks are welcome to raise your hand virtually via Zoom, or take out your camera, or turn your camera on and actually physically raise your hand, or pop a question in the chat. I'm happy to read out loud if for any reason you can't. Feel free to also take a minute to think about a question for Priti, since we do have such a good amount of time here to engage.
I would love, Amanda, since we have a certain number of people on the call, I don't know if people feel comfortable, but I would love to hear what people are working on too. I think it would be very helpful to understand this space and start to connect the dots between what people are thinking about and doing, and then the issues around IP in the system.
Sure. Yeah. I mean, if folks are willing, we can definitely go round robin and just kind of introduce ourselves. I think folks already kind of know who I am, for better or worse. But yeah, I'm also interested in, I'm a PhD candidate in English, studying psychedelic rhetoric and the way that people talk about psychedelics and the evidence that we use when we talk about psychedelics, which is a tie-in to the patent stuff. Luke, I see you're unmuted. Do you want to chime in?
I can. Thanks for the wonderful talk. I guess my question is kind of maybe unformed, but related to exemptions. If patents are granted on certain compounds and substances, people who have been using various substances for a long period of time, hundreds of years, indigenous use, whether or not you see that as, if there is that sort of long-term use, do you see exemptions as useful or not useful? This is just one of the sort of the solutions that I've heard discussed.
Yeah, I mean, there are people who have thought about this more, obviously, in the psychedelic space. So I would invite any of you, Graham, anyone to respond to that question. I'll say in general, what I have found over the last 20 years is looking for exemptions or exceptions to rules makes it much more difficult for medication to be widely accessible. So even if you get a selective win on that, it's not something that you're always working against the tide, as opposed to having the medication actually reach people. Like in our experience, with something that's maybe a parallel, using compulsory licensing over the last 20 years, which is where a government can choose to override a patent to ensure that public health needs are met. It is few and far between where we've actually been able to get that to happen. And the countries that have been able to do it I remember in 2007, Thailand did it for some HIV and cardiovascular drugs. And they actually had the support, I remember, of President Clinton, or former President Clinton. Is he still the president? No, he had started the Clinton Foundation. They had the support of the president because he was trying to, through Clinton Foundation, trying to make sure that these medications could reach everyone worldwide. And the health minister of Thailand announced that they were going to actually override the patents. And they got so much blowback from the United States Trade Representative, from companies, from lobbies, from other governments. And so that stands out to me as one of the lone instances of where a country did it. They were successful. The GPO, which is the Thai production facility, started to produce, but there were a lot of consequences from a trade and economic perspective. I don't doubt that if exemptions were allowed, I think it would feels like a tough fight to me, but if they were allowed, that there would be a lot of blowback and restriction there as well, because there's just a lot of money on the table. So I really like what you all are doing in terms of saying, well, this shouldn't be under an exclusive right to begin with, because of the way that knowledge was already in the public domain. It feels better to stop it at its root.
Mm-hmm. Maybe like kind of jumping off of that, Priti, I wonder if you could talk a little bit more specifically about what strategies you did use in those first 10 to 15 years of IMAC to free up that $2 billion, right? Like, to what degree? It sounds like our wheelhouse with Porta Sofia, right, is through this prior art search stage of the patent prosecution process, right? Yeah. And so really looking at surfacing prior art to make that accessible to patent examiners and also innovators, right? But it strikes me that you're doing something very different. And so I guess part one is like, have you encountered or engaged with the concept of prior art in any of that advocacy work? And if and either way, what other kind of stuff have you been working, or what other strategies have you used?
Yeah, I would say the first 15 years of work, actually, we were most focused on prior art as our organization strategy. The broader movement was engaging in advocacy to reform patent laws or to bring in health safeguards, which we successfully did as a movement in South Africa and India and Argentina and Brazil and Thailand. There's a lot of places where we were able to change laws, policies, and rules, which is very hard work. And there is a lot of blowback, but in the end, it's the thing that has felt most beneficial. Systemically, we've done culture change work to make sure that patent examiners are meeting with people whose lives are affected by their decisions and helping explain the landscape of a given therapy or disease or drug class. And so that sort of culture shifting work and relational work has also borne a lot of fruit. We have engaged in administrative and litigation proceedings to either invalidate or revoke patents, or to stop the granting of patents before they were granted. So either pre or post-grant observations or oppositions, or invalidation or revocation proceedings in court. That work has had mixed success. It's worked, but it's been drug by drug, case by case, country by country. It's not a systemic fix, which is why we've now sort of moved towards doing more systemic law reform work. But that work is certainly very important in a near-term perspective to get medication to patients. We've advocated for compulsory licenses as well. And then somewhere along the way, we sort of have a divergence in the movement where some people started to work on voluntary licensing. How do you get companies to do better by engaging in better licensing practices to get competitors to start to produce right away? And the reason that was sort of a sticking point within the movement was because a lot of those licenses were an improvement on the status quo because they were more transparent. And they allowed for earlier generic competition, but they had a lot of geographic restrictions. Large parts of the world were left out. And those markets or communities were tightly managed. And a lot of people still don't get the drugs. We saw this last week with the Paxlovid, the Pfizer COVID drug announcement, where there are many countries who are just being left out altogether, particularly in Latin America. But in terms of our organization's work, when I say we focus mostly on prior art, what I mean by that is, like, there is a real gap in patent information in the public domain. We understand this in the larger context of the medicine system, where everything that drug companies do is believed to be a corporate secret, whether it's clinical trial information, whether it's patent information, whether it's R&D spend. You know, they get away with saying that everything is a secret. So what we set out to address, you know, when we started working together in 2003 was, well, how do you change that power dynamic? And the first step is to make patent information available to more people. So we did that on specific drug classes, you know, HIV, hepatitis C. I think we did it for avian flu, we've done it for vaccines, we've done it for a bunch of stuff. And what we would do by making that patent information available to health ministries, to procurement agencies, to international health institutions, it enabled them to make better decisions about where competitors could enter and bring down the overall cost. So as part of that exercise of creating landscapes and conducting freedom to operate analysis, which is basically you're trying to figure out who else can enter the market. As you know, Amanda, what we were trying to do was also identify the key pieces of evidence that could be used to launch legal challenges, or I think perhaps more akin to what you're doing, or equally important to what you're doing, is to make sure that patent offices had the information that their examiners simply didn't have the time to understand. Like, we were a group of, whatever it was back then, 7 people who did nothing but look at HIV as a class. And so we obviously had more time, more manpower to just look at one drug and the patents. And so the way that benefited the public domain is that patent offices got better information to make their decisions on a given drug class. It also meant that things that never should have been patented were rejected upfront rather than later in litigation when the cost has already been incurred by health systems. It gave a lot of power to communities where they had all of that information. So when we, for example, communities were engaging in cross-jurisdictional litigation, like we could file the same case on a drug in Europe, in India, in Brazil, and in China, different community groups would challenge the patents there. We would be able to see that a drug company was saying 2 different things in their litigation in 2 different countries. And that really served the work, because then we could say, well, they said the exact opposite in China, you know, European patent office. And I think, honestly, I don't think drug companies are thinking in those terms, right, to coordinate what arguments they're making. And they never thought that it would be used against them. Your situation is slightly different, because what we were trying to do was make sure that drugs that had been on the market for a certain amount of time, when those extra patents were being filed, we were trying to make sure that they weren't blocking if they were frivolous. I think what you're doing is different, because you are also saying that even if these are newer therapies, if the knowledge on which they are based is old, if I'm understanding correctly, and actually belongs to somebody else, we need to have a different understanding of what patenting looks like. And you're affecting the whole market as a result. So it's interesting and it's exciting. And I think that it's worth having somebody also write this up, because the one thing I do know as I move in a lot of different worlds, is I think more people need to understand the work that you all are doing, especially in government, at the PTO, in the media, and people who really care. I mean, we're in a mental health crisis as one example in the country right now. So how do people understand that there is something that can unlock that crisis, but it requires these things to happen and greater attention to be given to the work? So yeah, those are all my thoughts.
Thank you so much.
I have a question. Hi, my name is Cece. I'm a data architect at Porta Sofia. Really just great talk. I love the connecting emotionally, and then just really great stats. And we actually used one of IMAX report in one of our talks recently about the drug prices. So thank you so much for that. I guess my question is, it seems like examiners really don't have a lot of time to evaluate if a patent should be granted or not. And just from like our own search and our own like third-party submission efforts, it does take like a considerable amount of time to be able to go through a whole patent in detail. And some of these have hundreds of claims. And I'm just kind of wondering, in terms of patent reform, that process, is there any way that examiners could get more time or just more resources? Because there are, I would say, excessive like published journal articles that they may just not have time to read through like 30 of them.
Yeah. No, I think that's right. That's actually in the editorial as one of the parts of the reform process. Is part of how you raise the bar is to give examiners more time and more resources. I will say that I think that is a partial fix. I think that I don't know that they would find what you found. Like in our experience, it takes people who are really committed to making sure that knowledge wasn't previously known to be able to build that case and prove it. So there was a model maybe 15 years ago in the US called peer to patent. I don't know what happened to it, but it was the idea that the PTO could actually take public input in a more formal and institutionalized way. And I think that's the way, like the work you all are doing, then you're providing that in a package to the examiners to look at, because I'm not sure, given the depth and breadth of what they look at, that they're going to find the same things that you are. But it's definitely part of the conversation on reform right now.
Hi, my name's Jax. I'm a master's student in the PPI program at UW-Madison, and I'm also an archival research network participant with Porta Sofia. And I just want to say also thank you again for the presentation. I really connected with what you were saying about the HIV medication, which had a patent filed on the liquid formulation. I actually work in a pediatric pharmacy for my day job, and I see that come up a lot where a pharmaceutical company will make a liquid form of a product that's already generic and then claim exclusivity over it. So I was wondering, for opportunistic patents that are filed like that, where there's a very established pattern and strategy to it, is there anything that can be done to combat all of those claims globally, or like within one nation's patent system? Or does it have to be handled more on a case-by-case basis?
So it depends on the country. What India did in 2005 is it amended its patent law to have a health safeguard. It's called Section 3D. It's called the efficacy standard. And it says that when you have a known compound, and then there's a new form of it, whether it's a syrup, it could be a combination drug, it could be a crystal form, that's doesn't actually require an inventive step. For all of those types of forms of older drugs, that they're not presumed patentable. And actually you have to demonstrate that there's a significant increase in therapeutic efficacy. India continues, it has held strong to that law now. I guess it's been 17 years since we got the law change, but I just heard yesterday that this week, or maybe it was yesterday, that the United States Trade Representative, the USTR, put India on its watch list for Section 3D again. So it doesn't come without consequences when a country takes that action. But it is, it is going to be interesting to see how can we learn from the experiences of other countries and think about how is the US going to raise the bar? There's now been 7 years of congressional hearings discussing the problem. And if you read the Congressional House Oversight Report from December, through research and through subpoenaing a lot of the company's documents, they are able to show like conclusively that this is what's happening. But then there's that next step in the US, because the lobbies are so strong about what would good policy look like, which we're going to be trying to develop through our PCM process in the coming months. So if any of you are interested, please reach out to me, because we'd love to have your expertise and perspective on like what that could look like. And then there will be sort of the Herculean task of how do we actually get it passed into policy or a law, which is a whole different conversation.
Thank you.
Should I let this person in the waiting room? I see someone.
I don't worry about it. I'm messaging them. I don't have their full contact info, trying to avoid Zoom security stuff. So I'm on it. Yeah, but if other folks have questions, feel free to jump in, or if you just want to kind of introduce yourself and kind of where you're coming from when it comes to the psychedelic patent world.
I have a question. So it seems like a lot of this is focused on after an application is filed, but before it gets granted. I wonder, are there ways to incentivize applicants from just not writing these overly broad applications? Like if multiple people are granted technology that cover the same thing, wouldn't there be disputes? Just ways to incentivize that.
Yeah, that's why we have so much litigation, you know, it's like, it's just, I don't know what the right deterrent is. That's a part of the policy we want to develop with community in the coming months, is how would you create a deterrent to that kind of behavior? You know, there's people have talked about, you know, penalties. I mean, this stuff is a drop in the bucket for the industry. They don't care about that. So it's got to be a stronger disincentive. One thing that's been raised with me a lot by people in the pharmaceutical industry or just small and medium enterprises, basically, is that we need to distinguish between the behavior of the biggest drug makers, you know, like big pharma, as some people call it, which this is just a shop for them, right? Like law firms, in-house counsel, versus small and medium enterprises, startups, people who are trying to actually like innovate, bring something to market, and don't actually have a different ethos. Not just in the psychedelic space, I've been hearing from people across disease areas who are like, we agree with the need for reform. We want to behave differently in a marketplace that doesn't incentivize it. So almost inviting us as the Access to Medicines movement to think about how can we start to shape culture in the absence of law reform? How can they start to like lead a movement as business leaders or as investors? You know, there's like opportunity for culture change in those ways, like what investors did with BP and oil, you know, many years ago. That was them acting against their self-interest to start be the change, you know. So how can we start to bring more communities in to start to drive change from where they sit?
I had another question. And that's, you know, around what you mentioned in terms of the culture shifting efforts and like sort of confronting patent examiners, or like sort of connecting them to the folks whose lives are changing as a result of the decisions that they make. And I guess I just wonder, because, you know, patent examiners are our primary audience, right? Like, to what are the logistics involved with making something like that happen? And maybe what are some of the obstacles, you know, or things that you have to be aware of when you're kind of trying to roll out an initiative like that? And maybe more broadly, if you have like specific stories related to that, I think I'd love to hear that.
Yeah, so that approach started in India. In the early 2000s, we started going with people living with HIV to the patent office, and just, we didn't really, it wasn't really our role to play, right? It was people who were affected, who needed medication, but they just didn't, like, there's a role that you have to play as a movement lawyer, where, or as an attorney who is committed to a movement, where you have access, you know, patent lawyers, you know, patent agents, you know how patent offices work. And so just kind of bridging that gap. And in the years that followed, not just people living with HIV, but farmers, people involved in the movement around sustainable food. I mean, there were just so many groups, women's groups that emerged that started to build their own relationship with the Indian Patent Office. In the years that followed, like, that work happened in different ways in Brazil, Argentina, Thailand, Morocco, Egypt, across Europe, Eastern Europe, in Ukraine and Russia. It's just, it happened in different ways. So I'm trying to think about, in some cases, like, we were able to facilitate introductions and go for, like, we went in Argentina for the first meetings. In other places, there was a robust civil society initiative already underway, where they would have the patent office host a meeting with academics and civil society, and then we'd be invited to also come in to offer a global perspective. And in other places like Indonesia, Vietnam, Ukraine, I mean, it started with people who are affected just figuring it out, like knocking on doors, making sure that they directly had access to examiners, which examiners are just, my experience with examiners all over the world is that they're really good people. They're public servants. They are just doing a job that is most of the time not very interesting and not very fulfilling and doesn't pay very much. And so they welcome getting to talk to real humans about, and really a lot of people, it felt like, were opened up. And it was a good counterweight to the fact that the IP establishment at the national and global level in most places sends, you know, almost like lobby groups in, or judges to go train other judges, examiners to train other examiners. So this was sort of a counterweight, grassroots counterweight to that. And it worked, I think, incredibly well. I think in the long run, and some of you may know Azadeh, this is the work she sort of coordinated and funded worldwide back then. With the belief, I think, that in the long run, it is people who are directly affected, who are on the ground, who will be able to make sure that those systems don't snap back. And so when I think about the US, I think it's hard. There is POPA, which is the examiners union. There are individual examiners, but there are guidelines on how they communicate. You know, the pharmaceutical industry's lawyers have access to them. They get telephone calls repeatedly. Some of the patent lawyers might be able to say more on this, but it's a war of attrition. So they can go back to an examiner to the point where they wear them down and they just grant the patent, because all the incentives are directing them to grant the patent rather than reject it. I think we have to forge a new way. And I see your work as being, you know, maybe also the diabetes groups, but like, there are a couple of communities, let's say, who could really lead this effort to shape how examiners engage with the public directly. Because I wonder what will happen if you make a request, if you write to the new PTO director and say, you know, we'd love to meet with your examiners and do a briefing for them on psychedelics and prior art. I wonder what they would say and whether they would allow it. And so this is where the advocacy, we have to push, like, this agency is there to serve the public, not to serve private interests. And so our voices have to have an equal seat at the table with the private interests. And to do that, we're going to have to push. So that might be an area, if you wanted to talk more offline or later, we'd love to strategize with you about what that would look like.
I'll just follow up and say, one of the things that we are aware of as far as like a sort of opportunity to do some professional development training around prior art and psychedelic space is the sort of ongoing education workshops that patent examiners have to take each, you know, to stay certified, that kind of thing, and perhaps pitching something for them. But yeah, my mind is spinning with possibilities right now and I'm inspired. So yes, definitely we can talk more offline.
Yeah, I think that'll be great. I wonder, yeah, I mean, if you did that, it would be really groundbreaking, I think. So excited to see what happens with that idea.
Can I ask one final question, if that's okay? I uh, I just was attending a conference this past weekend, and there's a lot of smaller companies that were there rather than quote unquote big pharma. And I just wonder if you can reflect a little bit on what kind of education and outreach activities you think would be successful with smaller companies. There were some panels that I attended, and I don't want to name any names or companies, where there was recognition that the idea was we need to develop assets and we needed to develop IP in the hopes that a larger company would gobble them up in the next 2 to 3 years. That this was, explicitly stated. And, alternatively, I wonder what Porta Sofia could do and the network/movement could do to suggest that there is a different pathway.
Hmm. So do you mean in terms of having that type of influence?
Yes.
Yeah, this is the $1 million question. I'm going to think for a second. Yeah, this is a tough one because we are definitely outmatched, right, in terms of resources and manpower. I've talked to people in the last year who have told me when it comes to judges on the federal circuit, the amount of influence that comes in from the industry. When it comes to examiners, like examiners are going to conferences hosted by the pharmaceutical industry, or they go to just general conferences, but then the lobbyists are there, or the community's there to give them a full court press to influence them. The only thing that I know personally is like the way to counteract that is to have a very visible public voice asking for a counterweight, which is part of why like we advocated that the New York Times editorial board would actually put something out, do their own investigation and reporting and put something out on this issue. Because unless we are more visible, louder, and saying that the system is skewed in favor of these influences, we just don't have a shot. And so that was, again, during COVID, something that became very apparent, where it was the number of people speaking out publicly to say something's not right here, this is wrong, that then would lead to policymakers who are being courted, we had pharmaceutical industry lobbyists leaking documents to us because they felt so ethically conflicted by what was happening with the vaccine stuff. And so policymakers were understanding, because the debate was out in the public domain, that they needed to hear from other voices. So I think that it's effective to, you all have done a remarkable job actually of getting journalists on your side. Maybe going a bit even more mainstream than that to help the public understand why that counterbalance of influence is so critical. So then spaces and opportunities get opened up. But ultimately, even if that step is successful, the hardest barrier I see is the culture change and the mindset within people in this ecosystem itself. There are some examiners who are sympathetic. There are many people who work at PTO or in those ecosystems that are not, because their values have aligned so deeply with big industry's values, like they don't see how to separate them. And so that is relational work, I think. I think it's building understanding over time. It's building human relationship, not just on let's argue about whether you should take my prior art or whether you should hear a different approach to examination. But I think they also have to be in relationship and in community with more people outside of that ecosystem. So yeah, I would love to see examiners being sent to your conferences, you know, or having you guys speak at more of the conferences they're attending. I think those are all good tactics to try. But it's hard. It's hard to penetrate, but not insurmountable.
Priti, I have a question about just having a presence in these conferences that the examiners are attending. That's one of our goals too, is to make sure our audience is the one that we want to reach. But we've had a really hard time knowing where they go to conferences. Like there's no just like, here's an examiner conference for psychedelic sciences. How do you find where they are looking?
Yeah, so we have not done this work, but I can connect you with someone who's thought a lot about this. His name's Chris Morton. He's a professor at Columbia. He used to be in private IP practice and now he teaches. But he sees this as a particularly important place of intervention. The way that we have gone about it is not with examiners, but it's with the IP community. So we are at Bar Association conferences and we do panels where we have a range of perspectives. We always have someone from the branded pharma, from the generics, and then a couple of public interest folks. So people are getting a range of perspective. I find that the IP community is not open to really doing that in reverse. A lot of the conferences are run by much more ideologically entrenched people. And so even during the height of the IP waiver debate for COVID, where like pretty senior people in the IP community were telling them, you're only having 4 people on the panel who are saying the same thing. Can we at least have some people who will offer a different perspective? They wouldn't do it. So I'm not sure. I mean, I think it's still worth fighting for that, but because they run them and they view IP as being under attack, which, you know, I don't think it is, but that's their perception. They don't seem open. Examiners, though, are a different category, and I don't know the answer to that, but I'd be happy to connect you to Chris, who I think would have lots of ideas.
That sounds great. Thank you.
Yeah.
Any final questions?
Yeah, I have another question just on like sort of raising more public awareness. We are starting we're starting to get more on social media and just sort of like build awareness for us as a resource. And then one of our efforts is to do like a weekly post of the latest published applications or issued patents. And these are just available, you know, at the USPTO, WIPO, but just to get the public, just to make the public more aware of like what are in these patents, like the themes that are coming up, the claim, like sort of summarize the claims and translate it into an easily digestible like awareness. Like, is that something that would help with like just bringing more awareness of what is happening in this space, even though we're not in these particular, let's say like tweets, we're not saying like get involved in this way, but just here's an awareness. Like, do you think that has an impact at all?
You mean on specific pieces of knowledge?
Yeah, so each week the new patents that come out, we tweet, we'll like select ones that are what we deem tier 1, so the ones that are most threatened, and then we'll like summarize it and be like, this new patent was published this week, and it contains like using this thing to treat this thing. And so they're usually pretty broad, and for that is like an effort to just bring more awareness of what is happening in a real time, so that more people can know what's going on. And maybe, you know, they see something that they care deeply about, like a Alzheimer's, Parkinson's, and they might want to then get involved because of that.
My gut reaction is it really depends on who your audience is. Like if it's patent examiners, I don't think they're on Twitter looking at patent stuff. I don't think so, but I don't know. it's worth doing some diligence on that. If it's the IP community who cares about the public interest, yes, I think they'll follow that and find it interesting, but it's a very small community. And they get their information on lots of non-Twitter sources. So it almost feels like it would be worth list building, like how we have our newsletter that I shared. It's like getting the people who actually want that level of technical detail to be on some list where you put this out. And then use social for things like, you know, you've had, I think, multiple Shayla Love pieces that are amazing for framing the stakes in a much bigger picture way. I find that social is better for things like that. But, you know, it's not to say don't do it on Twitter, because you might have 30 academics following you who find it interesting. But even with most academics, I find that they don't have the time or staffing or background expertise to follow specific patent mechanics. They usually need a translator, you know, like a patent lawyer who can help them understand the broader implication, which is maybe a heavier lift than what you're doing. But that would be the reason to do it, I think, on social. That's just my unfiltered thoughts on it.
That's very helpful. Thank you.
All right. Well, thank you so much, Priti. Again, that was really amazing. And I'm really excited for tomorrow. Priti is going to be joining us again for our roundtable on Indigenous knowledge and patent law. And she'll be joined from Dr. Tink Tinker, Sutton King, and David Casimir, and then Graham Pechnick, who's here right now, will be our moderator. And we'll be kind of digging into the question of whether or not Indigenous knowledge should be considered prior art in the US, and if so, what steps we should take to make that happen. So is that even a desirable thing? And if so, how do we make that happen? And then I'll just say that the rest of the day today, we just have our Ask Me Anything drop-in hour about archival research. So it'll be me, Luke Rickert, who is our academic advisor for the Archival Research Network and our historian of drugs, and also Stephanie Schmitz, who ran our workshop yesterday, and she's the archivist at the Betsy Gordon Psychoactive Substances Research Collection. So for those of you in the Archival Researcher Network that are kind of working on various targets or have questions of any kind related to archival research, whether that's for Porta Sophia or more academic pursuits, please drop in and say hello, and it'll be a pretty laid back environment. So that'll be how we wrap up today. And then tomorrow morning, Dave Casimir is going to give a talk, a little bit of a spotlight talk on mescaline as it relates to archival prior art. And yeah, thanks again, Priti. Thanks everybody for being here, and hope to see you throughout the next couple of days.
Thank you.
Mm-hmm.